Things nobody tells you about giving birth from a labor and delivery nurse who has given birth to 3 babies. Number one, after your water breaks, you will continue leaking fluid until you deliver baby. What's really happening is your bag of water is this protective barrier full of fluid that contains nutrients, antibodies, electrolytes, urine from the baby drinking it and peeing back into the amniotic fluid. Throughout your whole pregnancy, your body continues to regenerate and exchange out that amniotic fluid all the way until your baby's born. Another reason we see this leaking throughout labor is just the physical position of the baby and the fluid in the uterus. Bag of water breaks, it doesn't just sort of explode and disintegrate. It actually remains intact except from the area that was torn or has a hole. You can have a leak, maybe a little bit higher, trickling. People have a large tear at the bottom and they do see a lot of loss of fluid. The baby's head oftentimes descends and it slows down or blocks some of that fluid that was above baby. Number two, if you choose to get an epidural, there is a possibility that it doesn't give you the pain relief that you were hoping for. In fact, this happens to about 1 out of every 8 people. There are a lot of different reasons. This could be the placement or the dosage or maybe even some people's anatomy. Sometimes an epidural, despite all of our tools and our tricks and our position changes, may just end up working better on one side and not well on the other. There may be something called a hot spot where a lot of it has been really well medicated, but maybe there's one area that is just not responding well. I'm not saying this to scare anybody. It's just important people are aware of this so they can have maybe backup coping mechanisms or pain management tools. Number three, even if your baby is head down, they may be sort of turned or angled in a certain position that can impact your labor progress or your pushing progress. If you have a baby right in the center, midline, and they are looking at my spine, that position tends to really work well for labor progress and pushing. It's the angle of your sacrum, the shape of the pelvis. It's a little easier for baby to sort of nosedive through the pelvis and then sort of rotate their way through. Looking at your belly button, sunny side up, it can be trickier for the baby's head to extend under and through the pelvis. Sometimes their chin may hit their chest. Maybe the baby's turned a little bit sideways. Maybe they're at an angle. You can still absolutely have a vaginal delivery this way, but it can be longer and trickier. This is why it's important for your staff to be proactive, encourage you to move and change positions and use a birthing ball if it's safe to help facilitate baby kind of corkscrewing their way through your pelvis. And we see this in the research that maximizing your mobility while you have it and changing your position can really help facilitate labor. It's time to push and your baby's head is right down there. It's gonna feel like you have to take a massive poop. Baby's head gets really low and it kind of angles itself backwards toward the rectum. And I mean, it's crazy pressure. It can be really, really intense for people. And this goes for an unmedicated birth or a birth with an epidural. Honestly, that's a good thing because we're gonna wanna push right where we're feeling that pressure. We're gonna kind of wanna breathe down into it.